Within the last hour, Lincoln police have provided an update on that accident where a 40-year-old woman was hit in a crosswalk in East Lincoln and suffered serious injuries as a result. We now know that woman has since died. Rescue crews were called out near the area of 84th and A just after 2:30. According to police, the 40-year-old was walking along the crosswalk just north of that intersection when someone ran into her with their car. A section of that road was closed off for several hours while crews cleaned up. It's not clear if anyone will be charged yet. For the latest coverage, head to our 1011 Now app on Roku. We have spoken with the people who have fought for medical cannabis, the people who have fought against it, its uses, and the people who want to use it. So far, you can possess up to 5 ounces of medical cannabis and a variety of THC products, but our neighbors to the west and east have legalized marijuana recreationally. In today's segment, 1011's Jake Lawson and Matthew Mittleider take a look at marijuana's effect on Colorado economically and socially.
In 2012, Colorado moved to legalize recreational marijuana statewide, becoming the first state in the nation to try it. Since then, Dr. Sean Swanson, an economist and researcher with CU Boulder, has been keeping an eye on how it's changed the state.
I'm pretty agnostic, right? I live here in Colorado. I just want to figure out what's really going on.
Colorado voters legalized the drug through ballot initiative, similar to Nebraska. At the time, arguments against the drug being legalized echoed some of the sentiments in our own state legislature.
If you legalize marijuana, you're going to kill your kids.
Dr. Swanson says both supporters and naysayers got some things right and others wrong.
One of the things that opponents put out there was that, oh my God, this is going to be getting in the hands of kids. This is awful. Every kid on earth is going to be smoking marijuana. That turned out not to be true.
Data and crime statistics from Colorado show that some of the alarm around recreational use may have been overblown. DUIs have steadily declined since 2012. Though fatal crashes have increased, Dr. Swanson says the overall number of traffic accidents hasn't spiked. Violent crime, on the other hand, has risen since legalization, but Swanson says the correlation between that statistic and marijuana isn't strong.
You might get petty crime around dispensaries and stuff, but there's really been no good research suggesting that marijuana leads to violence.
While research shows most kids haven't taken up the drug, Dr. Swanson says more adults have, leading to an uptick in cannabis use disorder.
Now that does appear to be on the rise, maybe to the tune of 10%, but estimates are all over the place, from 5% to a study that I think is completely wrong that cites it at 20%.
Despite that, Colorado remains one of the stronger economies in the Midwest, and the legalization of recreational marijuana has helped. In fact, in 2024, the state raked in roughly $250 million from marijuana sales, and that's on the lower end of what it's earned in previous years.
There's tax on recreational sales of 15%, and then there's tax of 15% on wholesale transactions, okay? So that's 30% right there. There's also just the standard sales tax, 2.9%, and some local municipalities and districts also can tax it.
In total, Colorado has brought in more than $3 billion of marijuana tax revenue since 2014. Because Nebraska's population is only 1/3 of Colorado's, if legalized recreationally here, marijuana would likely only put a dent in property taxes. But it could be beneficial to balancing the state budget, which is currently projected to have a more than $400 million deficit at the start of next session. Swanson says there's still a lot of research needing to be done on marijuana, especially since so much of it was done with lower THC cannabis. He also worries about conspiracism contaminating current research.
If somebody is researching to prove a point and not just interested in what the data is saying, right, they're going to prove their point. That's problematic. It makes it really hard to do my job.
Reporting in Lincoln, Matthew Mittleider, 1011 News.
Nebraska medicine statistics show the state's psychiatry workforce grew 8% from 2020 to 2024, but both rural and urban areas are still underserved. 1011's Darsha Dodge caught up with one group today who is working to give non-psychiatric frontline healthcare workers the confidence and skills they need to help bridge gaps in care. Darsha?
Well, Madison, nationally, the average wait time for mental health care is at least 48 days. And for those in crisis, time is of the essence. Bridges to mental health, making it easier for non-psychiatric frontline healthcare professionals to help in the interim. Statistics from the National Alliance on Mental Health show that more than 376,000 Nebraskans have a mental illness, but more than 1 million live in communities without enough trained professionals to help. Bridges to Health is a workforce training program believed to be the first of its kind that helps non-mental health professionals bridge that gap in care. They focused on depression, anxiety, ADHD, and alcohol use disorder at this week's two-day session.
A lot of people have a good bit of knowledge already. Mostly what I think the effect is they feel more confident in using some of these medications and doing these types of interventions.
Bridges to Mental Health recently celebrated their 2-year anniversary, training more than 570 professionals in that time, and they have training scheduled in Omaha and McCook in the coming months. And as a reminder, if you or someone you know is experiencing a mental health crisis, dial 988 for help anytime. Madison, we'll send it back over to you.